I wanted to bring today's episode to the podcast talking all about male factor fertility, whether your semen analysis is low, the count is low, maybe there's DNA fragmentation, maybe the morphology is low, maybe the motility count is not optimal. Today, we were talking about everything you need to know about male factor fertility and really what you can do in a very short period of time to optimize your pregnancy success, even if your male partner has been told his semen analysis is normal and you're dealing with miscarriage or you're on the fertility journey. Looking at the health of your partner is essential. Let's go. Hey, Katie, excited to have you back on the podcast.
Hey, thanks for having me.
Today we are digging into male factor fertility issues, and a lot of times, although we're focusing with couples with low AMH and high FSH, premature ovarian insufficiency, diminished ovarian reserve, more often than not, actually, because a fertility issue is 50% male and 50% female. A lot of times we're, myopically focusing on the female, and we haven't even looked at the partner's sperm, or maybe he's being told his sperm is normal, but that may be normal in the conventional reference ranges. So we're going to talk about some of these things, themes to look to look for, and what you can do for the male partner. And so let's just talk about, well, first of all, the importance of checking the male partner.
Yes, really, really important. Like, this is such a basic thing that we can be doing, that everyone can be doing as part of their fertility workup, right? As you said, Sarah, really, really important to remember that even as a woman, if you know that you've got issues on your side, it doesn't mean that there's not also issues on the male side. So I think we can become so hyper focused on the woman and on her side. And let's face it, it's more often than not the woman that bears the brunt of the responsibility for things. But getting the male tested, like at the very least, getting a semen analysis done and then looking at that in terms of kind of optimal functioning is super important. And then also things like getting, just like getting a general sexual health check, like, those basic things are not to be sneezed at. We need to cover the basics first.
Yeah, and it's really impactful, and also we can see massive shifts in male in sperm in a very short period of time. So it takes 70 to 80 days for the sperm to renew. The life cycle of the egg is 90 days. So like in a short period of time, you can make massive amount of change. So let's get into it. Okay, so functional reference ranges, and functional reference ranges are optimal health. So you may be told in conventional medicine, someone looks at your semen analysis and they're like, it's fine. Or maybe they're saying, oh, it's a little bit low on these sides. So we're looking for optimal health and optimal fertility. So let's just talk about some of these functional reference ranges and what we can actually look for here, Katie.
Yeah, really good point. And first of all, just to note, Sarah, that before we even get to like the functional ranges versus Western ranges, the amount of people I see who are told by their primary care provider or by their clinic, oh yeah, like no further action on the sperm, it's fine. And actually, it's not even fine by the Western standard. Like, and you're like, okay, cool, like let's take a look. And it's like, no, they should have flagged this with you. Like, this is not fine. Even by their own standards. So first of all, there's that. So if you're told things are fine and you haven't actually seen the results, please ask for the results. Like, take a look at them with your own eyes. And then once we've moved past that, then we can be thinking about things in terms of what the typical Western ranges might be that we talk about a lot in terms of things like blood work, don't we, Sarah, versus the optimal ranges. And what we found is that the three things that are usually measured by the WHO, the World Health Organization, when it comes to sperm are the count. So the count is, I guess, the most common one, the best known one, and then the motility, which is how like the direction it's swimming. Is it going the right way? And then the morphology refers to the amount of damage that's seen on that sperm. So it's kind of like, is it properly formed? Has it got two heads? Has it got two tails? And also the volume. We take the volume into account as well. So for the volume, Ideally, so the Western ranges are typically looking at volume to be over 1.5 milliliters. We'd like to see this ideally sitting at 2.5 to 5 mils. Now, this can like vary massively from day to day, week to week. So, if you've had one episode of it being a bit lower than that, then not to worry too much. And a lot of the time, we need to ask the questions like, did it all go in the cup, right? Like sometimes it is just as simple as that. But yeah, so ideally 2.5 to 5 mils, and if it's not that much, then it's like, did you wait the right amount of time? Did you abstain for a couple of days before doing the test? These kind of questions, and if that is still the case, that everything it all went in the cup, I did abstain for the right amount of time, then maybe we need to look at the quality of the sperm and things like your testosterone levels to make sure that you are producing enough. For the count, again, like the Western ranges typically ask for 20 million plus, and the functional ranges are quite significantly higher. Like we'd love to see it ideally between 60 and 70 million. That for us indicates like really healthy count, and this is to, I guess, a nod to this quite infamous piece of research now, I guess, that showed that between, I think, was it like the 1940s and the 1990s, like over that 50-year period, like sperm counts declined by like 50% or something.
Right. I actually interviewed Dr. Shauna Swan on the podcast here, so you can go back and check out that episode, listeners. And it really talks about that study that was shocking, because, and then also they've moved what's the suitable reference range. Years and years ago, it was a lot higher, and now as sperm counts have declined, they're saying, well, this is optimal, but is it?
Yeah, exactly. So, and then we've got motility. So again, that's thinking about like the is it swimming in the right direction? Is it kind of going where it's meant to? And 50%, 40% plus would be the Western ranges. Typically, we want the motile sperm to be over 40%, and then functionally, we do like to see ideally a little bit higher than that at 50% plus motile sperm. And then the morphology, which again refers to the I guess like the quality of the sperm in terms of the form of the sperm and the shape that it takes. The Western, I mean, we're pretty low standards for this, to be honest. And so I guess what this means is we expect that a lot of sperm, because sperm is mass produced, we expect that a lot of it isn't going to be a normal form. And so, as much as sort of anything like as much as 96% abnormal is considered normal by Western medical standards. So they ask for anything above 4% normal forms. The functional, again, like we'd love to see that over 8%. And what that means is that 8% of those sperm look visually as they should. So that's, I guess, a little bit about those ranges.
Yeah, so let's talk about the DNA fragmentation, and just back to that morphology. Like we literally will see people being told it's normal at 4%, or like it's a little bit. They're like, oh, it's a little on the low normal at 3%, but if we're looking at 8%, like that's a huge, flag. And there's the part of this actually is empowering, right? There's things we can do. It's not about being running over to do ICSI, because the sperm is there's nothing we can do. In a short period of time, we see like sperm indexes and these numbers greatly improve.
Yeah, exactly. And it's I guess one of the things that you hear all the time from people who go to fertility clinics is, and what people often end up hearing from their fertility clinics is like, oh, well, actually, we're not really worried about the morphology, because it only takes one, and if we go ahead and do ICSI, then we'll just choose one that looks good, and it's fine. So often we see the morphology kind of like brushed under the carpet and not taken seriously. However, the DNA fragmentation piece of the puzzle, which you mentioned, is an association that I see a lot is for men who have poor morphology. That is to say, lots of sperm that are irregular looking, whether that is like two heads, two tails, etc. You can imagine that if a sperm is kind of, I guess, warped in shape like that, then probably there may be something to do with the DNA going on with that sperm, right? And so when a guy has low morphology, I'm always thinking about DNA fragmentation, because the morphology is literally what we can see under a microscope, right? So it's a visual on that sperm. There is no way of going into that sperm, just from looking down a microscope, we have no idea so we can't see the DNA. It's too small. And so, we can't tell from that investigation alone, from a semen analysis, what the DNA is doing in that sperm. And so there are lots of reasons why I might flag a DNA fragmentation as being an appropriate test to do, and poor morphology is one of those flags. So if you're listening to this thinking, oh yeah, like we do have poor morphology, or it's been brushed under the carpet, or kind of shoulders shrugged about it, this might be a really good time for you to consider doing a DNA fragmentation test.
And what should we look for the DNA fragmentation test then? Anything as far as to look for there?
Yeah, so I mean, different tests have different reporting styles, and you'll have if you do get that test done, they'll be very clear, and whichever practitioner does it with you will go through the results. But it's really to say that a test will typically check for the levels of sperm that have high DNA damage, so would not be fit for purpose, essentially, and then the levels of sperm that have low to no DNA damage, and then you should be presented with some information around whether this is sperm that would likely conceive a pregnancy naturally, or whether it would likely conceive successfully via IVF. And so again, people go down the fertility treatment route and things like IVF, and it's all kind of oh no, we don't worry about the sperm, we can just do ICSI. But actually, if you've been through IVF treatment before, which I know lots of your people have, Sarah, and lots of your listeners probably have, it's if you've done that before and there's just a recurrent thing of okay, well, it's just not happening, either the embryos it's not progressing to into successful embryos, or it's not implanting once you've had the transfer, or even early miscarriage, right? We people think that once it's in, that's it, the sperm's done its work. But I'm really sorry to say, because it's hard to talk about and think about, but we know more and more now that those early miscarriages can be attributable to levels of DNA fragmentation. So it's a really, really important thing to be considering.
Absolutely. And many times it's you're doing all that. Well, first of all, they won't do a workup, unless you've had 3 miscarriages, which is, absolutely outdated, conventional thinking. And then second of all, they're just focusing on the female partner, and no one's even looked at the male partner's sperm health, considered, what's going on with him. So all of this that's why we exclusively will coach couples, unless someone is single by choice. But it's so important to look at the health of both partners, and it is not about you coaching or nagging or dragging along your partner. Not to say that would be the case for people, but if that is, if you find yourself, oh, he's not changing his diet or he's not taking the supplements, it's really for you to lead by example, and he'll come around when he's ready. And that's why, to get a guide or a coaching team to help you, to have him have his own goals, because a partner coaching another partner is a recipe for disaster. So yeah. So let's talk about medication, and really how that can impact sperm. And many times people are taking some of these common medications. So high blood pressure medication, we see this a lot, anxiety or depression medication. And people, if you have, digestive issues and you're taking, something to help with acid reflux and things like that. So how does medication impact the sperm?
Yeah, so this is one where what I would really recommend is, if a lot of people are prescribed medication, short term or long term. I think in the United States in particular, it's I'm sorry, you guys have got a reputation over there for being on medication really, really long term. And what I'm not saying is, oh, just go and ditch all your prescribed medication, because of course that wouldn't be appropriate. But it's just worth noting that lots of people are given medications and then it's never explained to them, like, oh, well, what are the potential side effects here? And so it's always just worth like reading the label, like get back to basics, know what you're actually putting in your body. And if a known side effect for a medication that you're taking is that it can impact sperm or impact erectile function in particular, because I think that's a big one that can be impacted by medications, then it might be that you want to have a talk to your doctor about like what alternatives there are and how you can actually go about addressing your issues in a way that isn't going to be impacting your fertility.
Yeah, that informed consent. It's kind of like you go to the doctor, they'll pass you a pill, and you're like, okay, great, I'll take the pill, it'll take care of that. Meanwhile, on the small written pamphlet in there, it's got all these different side effects. And if you're on the fertility journey, again, it's like we're looking at the full body. Well, why do you have high blood pressure? What's happening with your mood, your neurotransmitters and more? And so it's really important to look at all of it. And now here we are, is this impacting egg quality? And we're talking today, sperm health. So it's not just in conventional medicine, it's that myopic side of things, and there's silos, whether you have your gastroenterologist, your dermatologist, your neurologist, your all your different specialties, and then no one's looking at the whole body.
Yeah.
So so let's talk about testosterone and what we're seeing there. We see a lot of people, like it is I think it's an epidemic right now going on with male, like as we age, it lowers, but male, like younger men having low testosterone. I was just listening to Dave Asprey the other day, and he's like talking about testosterone levels. And it's like, if you have low testosterone, he was like saying, because he's got a new book coming out. He's like, your drive to really change the world or make changes is decreased. So he's like, you might see, someone in distress or whatever. It's just interesting. He was just saying that you'll be like, you just won't do anything about it because your testosterone is low and you don't really have that get up and go kind of thing. And, if that's a warning flag, if your testosterone is low when you're on the fertility journey, to be able to dig into that.
Yeah. And I mean, I know we're focusing on men today, but it is worth noting as well that testosterone is not irrelevant for females as well, right? It is a sex hormone that is important across the board. But for men, especially, to come back to men and fertility, men need testosterone to produce sperm. It's as simple as that. The sperm is produced like directly as a result of testosterone. And where we're seeing declines at the moment, what it doesn't mean is that men, because I think we're at risk here of people listening to this and thinking, oh, right, okay, well, I need to go and like take a load of steroids or something like this to improve my testosterone. No, that's not the case. Like that's not a healthy way to boost your androgens and your testosterone levels. But the good news is that testosterone can be improved naturally by doing like or just all of the basics that we talk about all the time, Sarah, right? Like, stress and the I know we've done a whole podcast on adrenals and talking about the HPA axis and how that connects. So the HP being the hypothalamus and pituitary gland in the brain, and how that connects with the adrenal glands, and how they in turn triangulate with the thyroid and with the ovaries in women. It's the same for men, but with testes, right? And so in men we might call it the hypothalamus pituitary gonadal adrenal thyroid axis. So it's like the HPGAT, and that just goes to show that these are stress. Men's stress hormones are just as connected to the testosterone piece, to the sex hormones, and to the testes, to testicular production, sperm production, as everything on that side is for ovarian function on the female side. So stress, massive driver for poor sperm quality, massive driver for low testosterone and testosterone depletion, and like just sleep as well. Like testosterone is produced in sleep. Like that is when that's prime time for testosterone production. And like, how many people on the Fab Fertile book, Sarah, have poor sleep quality? Like, so many. And I'm sure so many of your listeners, so many people around the world really struggle with their sleep quality. And actually, if this was prioritized, then it gives the body a chance to produce the sex hormones properly.
Yeah, I'm doing a talk today about sleep in my group. So it's the low AMH and high FSH Get Pregnant Naturally group on Facebook. Well, there's a link below there, but basically in sleep, and it's not really a sexy topic. Oh my God, sleep, really? Yeah, I know I have to sleep. I'll sleep when I'm dead kind of thing. But sleep is something that we work with on our couples for months on end to really optimize your sleep. Because if your sleep is off, that is a huge indicator of other things going on in your body. And it's really, really important to address. And we've done many podcasts on that, but definitely join the group, and there'll be the recording for that. That will be in there. Let's talk about this myth here that sperm does not decline with age. You get 90-year-olds that can have children and they're perfectly healthy because the sperm is great and it's always the same from a 20-year-old to a 9-year-old. What's your take on that?
Yeah, it's a funny old myth, isn't it? And it's true that in theory, it is possible, there is a chance that a 90-year-old man could father a child, because a sperm is something that is produced rather than something that men are born with. And that's one of the key differences between males and females when it comes to fertility, is that women are born with their eggs. There's a finite number of them, and at some point they will run out, and and that's what the menopause looks like in healthy individuals, sort of towards the late 40s and into the 50s. But after the menopause, a 60-year-old woman, for example, couldn't mother a child with her own eggs, but a man in theory could. But how many 90-year-old men do you know where that's the case? I mean, it's very it's, I think, just a bit of like this kind of like, let's buff up men and give let's just buff up the male ego a little bit and pretend like it's all fine. But actually, sperm quality does decrease with age as well. That's not to say that it can't improve as well. It's perfectly possible that the sperm of a 60-year-old man could be like just as good as that as a 30-year-old man, if that 30-year-old man never gets any sleep and doesn't move and eats a terrible diet, versus the 70-year-old man who does has been committed for the last 30 years to good health. It's possible, but yeah, it's, as a general rule of thumb, sperm quality will decline with age.
Yeah, it's interesting when I'll ask people like, okay, tell me what your goals are, or what do you have, what's happening. And people will go through, all the IVFs they've tried, the IUIs, the medicated cycles, the embryos, the different stages, like a lot of detail into that, right? Because when you're in that fertility industry side of things, that's all you're focusing on. And then I'll say, well, how's your health? And then either they tell me it's fine, which when we do our functional lab testing and we look at your health history, it's not fine. It's not to say we're discovering, diagnosing or anything, but there's always something for us to work on. Or people will say to me, oh, they have an autoimmune disease, or, oh yeah, my sleep was horrible, or, I'm just so stressed out, or I've got, eczema, or I've got digestive issues. Like there's usually either it's two things. Either they give me a huge list of health issues, or they say I'm fine. And so, and the more we dig into and the more you become in tune with your body and what's going on, some of those symptoms are common but not normal. And the same for the male partner. Oh, it's fine. He's fine. Is he? And then let's look for optimal health, because the fertility, like pumping your body full of medication, hormones to force this to work. Obviously, I had my children with donor eggs using IVF, so it's there to help us. But let's work on our health first, because I didn't work on my health until years later, and it came crashing down. So it's really important now to build a strong foundation, and then for both male and females. So there's the rant. And so themes we see, and I feel like kind of like a broken record on some of these things, but we just see it over and over and over again. Literally just looking yesterday at our clinical mastermind, we had like looking at people's, looking at their blood chemistry, and then looking at tests, looking at gut infections. We look at a stool test, it looks at your DNA of your stool. Like gut infections, we see this all the time. Parasites, bacterial infections, food sensitivities, for both men and women. It's not just the female partner changing the diet. Males need to make the changes as well. And then also we talk a lot about protein and healthy fats, which are the building blocks of hormones, and the baby's brain is made of fats. And then that diet rich in antioxidants. Anything you wanted to say about some of those things there, Katie?
Yeah, it's I don't think we're going to dwell too much on this stuff today, Sarah, because it's this is the messaging that we're giving so much over and over again. But getting those foundational pieces right with diet and lifestyle, just noting, are you, if it's a male listening, or is your partner eating a diet that is like full of junk, full of refined foods, full of processed foods, and if that's the case, then your chances are that could be having an impact. Having a diet rich in, like, let's just get the basics right. Let's eat enough protein. Let's eat enough fat, good fat, not inflammatory fat. Let's eat enough like vegetables, all the different colored vegetables. That is eating the rainbow, and eating a wide range of plant foods on a daily basis is one of the single best ways to improve dietary antioxidants without having to do anything else, right? And so let's get those foundational pieces in place. Let's be mindful of, like, as you say, in terms of like the health questionnaires, when we're asking people, like, if you've got like, if you sit down and actually think about it and think, oh, well, actually, I do have like eczema, and I do have like explosive bowel movements, or like not, or I really struggle to go to the toilet, or if there's just like things that don't feel right in your body, if you've got like fatigue, if you get like sick all the time, if you've got skin issues, whatever it might be, these are all like little signs that our body's giving us that something's not right. And if there's an imbalance in the body, then the body doesn't operate in silos. Your reproductive tract and your reproductive system in particular listens to what else is going on in the rest of the body, because ultimately it doesn't want to procreate if it's not a safe place to do so. So it's just worth getting all of the basics in, like checking on things like the nutrient status, vitamin D status, checking in with stress levels, checking with sleep, checking with blood sugars, checking the thyroid, all the things that we say and wax lyrical about for women. The same applies for men. Men are not exempt from this stuff.
And let's talk about this, the spermatogenita. Okay, you can pronounce that one. Spermatogenesis.
Spermatogenesis, yeah. So this is the spermatogenesis is really just thinking about sperm, like from the very, very, very early stages of like being, teeny tiny little single cells, and right through to maturation, and then being stored in the prostate, ready for release. And that process takes 72 days from the very, very beginning until, until it's ready for ejaculation. And so it's just worth noting that the changes that we do or think about now, like it's never too early to make changes. And ideally, in an ideal world, what we'd love to see is both partners working on their health for 3 to 4 months before even trying to get pregnant. And I know if you're listening to this, you're probably not listening to this with the fresh ears of someone who's thinking about trying. You're probably someone who's unfortunately had a seasoned journey in this, but there is never it's never too soon to start, so start now.
Exactly. And that's why we have conversations monthly with couples to see where they are, right? To see it's because you start to see the health improvements, you see the blood chemistry and see, and also the symptoms in your body, you see this improve, and then that helps you to continue on. So, but it's a conversation we have with the couples all the time, right? Because we realize it doesn't matter where you are on the fertility journey, the moment you want to start having your baby is when you want to start having your baby. And so let's talk about, like blood flow and movement is critical for sperm health.
Yeah, so again, we talk a lot about from the female side, that those reproductive organs, getting blood flow to the uterus, etc. But we need to remember again from the male side that in order for the body and the cells in the body to communicate effectively and for hormones to be transported to the right place, good blood flow is super duper important. And the best way to get good blood flow is to move your body regularly. If we're thinking specifically about testosterone, if we're wanting to help to boost testosterone, then things like weight training, resistance training, those kind of workouts are the kind of things that can help to boost testosterone levels as well. So blood flow and movement is really critical. And also, some of the body work as kind of like holistic interventions. Again, is always, we always see the woman going to acupuncture, the woman going for this and that and the other. But those things can be helpful for the male side as well.
Yeah, acupuncture, reflexology. My husband literally loves reflexology. He's like, go on in there, touch my feet, and he just comes all like zen and really relaxed. And those the different body works. So let's talk about some of the important nutrients that we need to have for optimal sperm health.
Yeah, so just a quick run through of like some of my kind of top nutrients, I guess. I mean, we spoke about fats, so really the best kind of fats to support sperm health are omega-3 fatty acids. We've done a podcast just on that. Oily fish, flaxseed, walnuts, seeds generally. Zinc is a well-known nutrient that helps with sperm production. This can be found across, again, like seeds, seafood, beef, lamb, lentils, beans. Selenium, again, kind of similar story, seafood, Brazil nuts, asparagus, eggs. So selenium is a really nice antioxidant if we're thinking about antioxidants. CoQ10, again, we've done a podcast just on this. So lots of foods in the Mediterranean diet contain CoQ10, but lots of people do need, on the fertility journey, do need some extra CoQ10 as well. Lycopene. So lycopene is again, it's a nutrient that's really important for sperm quality. Lots of people supplement with lycopene. I don't necessarily think that's necessary, but if you eat like as many red foods as you can get, so things like tomatoes, red peppers, watermelon, anything with that red pigmentation, that's the lycopene that gives it that pigmentation. So that can be really helpful. Vitamin E, so nuts, again, like there's been research that suggests that men who eat a handful of nuts daily compared to men who don't have like better sperm quality across all parameters. So nuts, super easy thing to include in the diet, so long as there's not kind of allergies or intolerances there. Seeds and greens for vitamin E as well. Vitamin C, again, like just thinking like nice fresh plant foods, leafy greens, berries, citrus fruits, kiwis. And then the vitamin D, mainly from sunshine. We've done a whole podcast on vitamin D too, so do go back and listen to that. And then amino acids. So essentially, this is proteins. So again, lots of people wonder, like, should I be supplementing with like L-arginine and cysteine and these kind of things? Personally, I don't really think that's necessary. It's just about getting enough protein in. You wouldn't believe how many people struggle to get enough protein in their diet. It's one of the core dietary basics, that's something that people still struggle with. So getting enough protein is an absolute basic here.
Yeah, and we can see on blood work too, looking at protein absorption. So if you're kind of married to a certain diet plant, obviously more plants is good, but looking at the protein and we'll see, is that diet right for you? We believe in a very personalized approach. So if you're married to something, being able to look at that and having an open mind is key. We've done many podcast episodes on alcohol consumption. It gets people very excited. There's lots of studies coming out of, oh, you need to have more alcohol, like red wine a day is great for you. Oh, wait. Drinking any kind of alcohol. Now in Canada, that study came out saying that alcohol is not good for you. And like it was news. Like, really? Like people were like, oh my goodness, alcohol is not good for you. I'm like, that is the most ridiculous thing. I literally, and they're like, should we put warnings on alcohol? Well, yeah, like, or like, I don't know, basically buyer beware. I don't know if people think that it's great for you. It's just an outdated, or trying to have it's like back in the day when doctors used to recommend, the doctor will be smoking and said that, cigarettes can't harm you. Well, yeah. So alcohol consumption and semen quality, what's our take there? What are the studies showing us?
Yeah, I mean, look, there's been quite a lot of research into this. I'm going to give a couple of examples. So there was a study by some Italian researchers. So in 2017, so Ricci et al. So they conducted a meta-analysis and found that daily alcohol consumption, so men who consumed alcohol every single day, that's likely to impact sperm across all parameters. But then they did some research the next year and found that as little as 4 units a week, so let's say a large glass of red wine can be like 3 to 4 units, could impact semen volume and concentration. So there do seem to be very, very clear links, and really what we think this is around is it induces cellular damage. And cellular damage, like sperm cells are really important little cells, and so we don't want those guys to be damaged. And then there's knock-on effects as well from the point of view of hormone regulation that we spoke about, like that testosterone production, and then the genetic and the epigenetic regulation within the body. So there's ultimately it's down to kind of oxidative stress and really, really wanting to reduce any kind of stress on the body, and that includes stress that we've spoken about, right the way through to kind of any physical stresses on the body as well.
And this is not about deprivation or oh my goodness, or again, you nagging your partner, oh, he's having a beer, he's drinking. That is again, a recipe for disaster. He'll come along when he's ready. He can read the studies and decide what he wants to do. Most of the couples we work with are very open-minded, but sometimes many people are using alcohol to cope, right? So then when you have other coping strategies, just like people are maybe over-exercising or whatever it is, if you have other coping strategies, then, and it's not about as everyone else is drinking and enjoying themselves, maybe you would have more of a clean alcohol, like a tequila or a vodka or something like that could be cleaner. Maybe wine is not the right thing for you. If we see a lot of people with gluten intolerance, maybe pounding down a beer, but you can get a gluten-free beer. So it is to look at this. There's also lots of non-alcoholic options now, a sober curious movement with all kinds of cool things with they're doing, adaptogens and drinks. So you can kind of get that same cool, chilled out feeling if that's what you're looking for, without alcohol. So lots of options, but do not coach your partner either way on this, right? They've got to have an open mind and being ready to switch. And so definitely we've got more in-depth podcast episodes about that. But as far as other things that can impact semen, heat, sitting in hot tubs or having your laptop or anything like that on your reproductive organs is not recommended. All the environmental toxins that we're exposed to, the plastics, the EMFs, we've done many podcast episodes on EMFs, on the toxins in our environment, making sure you choose organic. don't be drinking out of a plastic water bottle. Don't have your phone in your pocket. Like, don't have it there. Put it on, first of all, don't charge it beside your head and put it on, flight mode, is what's recommended. But if you're a male, do not, well, anyone, don't put your phone on your body. Definitely listen to, I've done many episodes on EMFs, and it'll be just like, you'll never do that again. You can get a protective case for your phone. And also, I think, standard recommendations for fertility, even from the fertility clinics, are obviously reducing alcohol or eliminating alcohol, no recreational drugs. We see many people that are still, maybe marijuana. Again, that's how they may cope with things. And that's, there's studies to say that's better than having alcohol. But if you're on the fertility journey, is that the right move for you? And then, like, the biggest things we talk about is like those foundational pieces with your diet. You want to make sure you have that nailed in, a personalized diet, and the stress. So if all of this and you're like, oh my goodness, this is completely stressing me out, well, that's sort of counterintuitive too. So things that make you happy, intimacy with your partner, joy, things that give you, bring happiness to you. Those are huge things, as we don't want to have you constricted and feeling like, oh my God, everything sucks and we're not doing anything. This is sort of, where do you make changes, adjustments so that you can, improve your health there. And then just a little quick one here on, is there anything for positions for partners? Anything you wanted to say there to optimize, to bring this sperm closer to the cervix?
Yeah, I mean, look, there's no conclusive evidence around this. I know there's lots of stuff on the internet around positions, sex positions, etc., that might help or be better, and putting legs up the wall and all these kind of things. This is, it's, if that helps you, in terms of kind of feeling better about things and feeling comfortable, then great. But there's not really any evidence to support any sexual position being more favorable than another. What I would just say is, probably, if you're using a sexual position that is, where that's maybe a bit awkward and that it could slip out essentially, then, by deduction, then that could make things less likely to work. But so as long as it's kind of where it's meant to be, then we're good.
And then if he abstains for one day prior to intercourse, what are we seeing there? Is that a good idea? Like, what are we seeing to optimize chances?
Yeah, and here again, it does need to be personalised. So if that person has got an issue with the sperm count being low or the volume, then maybe like that day of abstinence in between can help to fill up the tank again. But having said that, for men who are more on the poor morphology and the low morphology side, or high levels of DNA fragmentation, one of the best pieces of advice, maybe not whilst during that time of whilst the woman's ovulating, but in the lead up to that, it's actually better to ejaculate daily and for frequent ejaculation, because it keeps things fresh, right? And if that production is elevated, then it can improve the quality from a morphology and a gene point of view. So it really just depends on what's going on for that guy.
Any final thoughts for us today, Katie?
Just going back to basics is the most important thing, and taking into account oxidative stress. And if you've got questions, then come to Sarah, join in her group.
Awesome. Thanks, Katie.
Thanks.